This might happen again. I get that question all the time. I can herniate the disc again, and I say, yeah, there's definitely a chance you can. My name is Paul Joseph Pagano. I'm an orthopedic spine surgeon. I've been practicing spine surgery for the past 22, almost 23 years. One of the things most spine surgeons will think about after surgery, and that's a recurrence. Recurrence meaning another piece of the disc comes out after you've removed it surgically. The reason that will typically happen is there's a defect in the hole or the covering in the disc called the annulus. The larger the hole, the higher the risk of a recurrence. This is a problem that's been around for a long while. There's been various products on the market over the years to try to address a defect in the annulus, large or small. I've used the suture products in the past. They were not very successful, but there's really no other device that I've used, and I've used a few different types, that actually I think works until Barricaid. Barricaid's trying to restore as much as possible your normal anatomy, meaning we're trying to plug the defect in the disc wall. The difference between Barricaid and a fusion means you remove the disc and you make the bones basically grow together so they don't move anymore. If you're a young person and you have a fusion, you might need more work above or below over time just because of the increased stress we cause by fusing the bones together. I haven't had a recurrence with a Barricaid device that needed any further treatment. I'm confident if I have one, I can still address that problem with whether it's another discectomy type surgery or a fusion procedure and still leave the implant in place. I think most spine surgeons understand that the risk of recurrence for lumbar disc surgery is there. And we all who do this on a regular basis know which patients are at higher risk. And if you have a patient in that category, I think you're doing them a disservice without at least evaluating them for a Barricaid, having it potentially available at the time of surgery, and if it's needed, implant it. I treat patients who work in various occupations, multiple occupations, and I just feel confident in those patients that their ability to return to normal activities is much higher if I can close the defect with the Barricaid device.